Well, I first got interested in Parkinson's disease as a third-year medical student when I had the opportunity to see some patients with a famous movement disorders neurologist in Houston. And I had the privilege of seeing patients both on their medication and off their medication. And I got a sense for just how powerful some of these medications were, and as well the limitations of these drugs. And so my dream really, which began then, was to figure out a way to help patients with Parkinson's disease and, if possible, to bring new therapies ultimately to bear in their care. Well, my primary goals in regards to this NIH-funded project is to essentially collect a well-characterized population of patients with Parkinson's disease and perform the clinical analysis on them. So what we aim to do is to try to recruit over the next 2 years 240 patients who have Parkinson's at various different stages of the disease. So we're interested in getting both very early onset patients, patients who've had the disease for many years. We want both younger and older patients, patients who are cognitively intact, others who may struggle a little bit with memory. And by enrolling these patients and carefully characterizing their clinical function, as well as obtaining biosamples of blood and cerebrospinal fluid, we hope to identify a biomarker that can enable us to carefully track disease progression as a tool for testing new therapies. Well, I think the primary aspect in which my work will help others is the sheer size of the undertaking that we're putting forth. Again, I have the privilege of collaborating with 2 other clinical neurologists who are experts in movement disorders. And so the 3 of us together, we hope to assemble a large number of patients. And by getting a large group of people whom we can follow for 5 years or even longer, repetitively sampling both their clinical information as well as blood and CSF samples, hopefully that will provide a pool, if you will, of carefully characterized specimens that my colleagues in the field can then analyze and hopefully ultimately find a biomarker that will help us to cure the disease. One of the key problems with Parkinson's research is that when we try to find a drug that we hope will slow down the rate of progression, many of those same agents also help to cover up the symptoms of Parkinson's disease. And so in effect, we have difficulty identifying disease modification because of a confounding by symptomatic improvement. This is where a biomarker becomes critical, because hopefully we can identify a biomarker that will not be influenced by the drugs that we use, and instead will track very linearly the progression rate of Parkinson's. And in so doing, we can then develop studies that will be much shorter in length and will involve smaller numbers of patients to ultimately get at the question, does this drug or does this agent slow down the rate at which Parkinson's progresses? Well, this is of course the key to the whole project, is we need volunteers of patients that are willing to share both their time with us and their biospecimens with us in order to accomplish this. So what we're hoping to do is have a multiple different phases of our recruitment effort. This will begin with kind of a website that the NIH will publish that will let people know where this research is being done. And then at a local level in Dallas-Fort Worth, where I practice, we're going to offer the opportunity to participate in this study to our patients. We're also planning on publicizing this among other doctors in the area. And our hope is that we will have multiple people come forward, eager to get involved in what we hope will be land-making research.